Welcome back, friends. Today, we're touching a nerve. Dental implants versus dentures. Sounds simple, right? But here's the twist. Most people make this decision without ever hearing the full story. Dr. Esma, I hear whispers of regret, hidden costs, and long-term surprises. Are we really being told the truth?
Rasim, you're absolutely right. Patients often walk in confident, then freeze when they learn what no one explained before. Comfort, bone loss, confidence, daily life. These things change everything. And the choice you make today can affect your smile for decades.
So if someone watching thinks, I'll just pick the cheaper or faster option, what are they missing?
They're missing the silent consequences. And once you know them, you'll never look at dentures or implants the same way again.
Let's get real for a moment. Imagine biting into your favorite food at a family dinner, and suddenly, your denture shifts. You smile, but inside you panic. Dr. Esma, people don't talk about these moments, do they?
They rarely do, Rasim. Many patients tell me they stopped eating certain foods, laughing freely, even traveling. Not because of pain, but fear. Fear of movement, noise, embarrassment. These daily compromises slowly chip away at confidence.
And then there's the other side. People hear implants are permanent and think problem solved. But is it really that simple?
Not always. Implants can change lives, but only when expectations match reality. Bone, habits, long-term care. Miss one piece and disappointment follows.
This is where it really matters. We're not just talking about teeth, we're talking about how people live every single day. Dr. Esma, you've seen patients come back years later, right?
Absolutely, Rasim. I've seen patients who chose quickly and paid slowly. Bone shrinkage, facial changes, speech issues. One gentleman told me he avoided photos for 10 years, not because he lacked teeth, but because he lacked confidence.
That hits hard, and the scary part is, no one explains this at the beginning.
Exactly. The right choice protects chewing, speech, bone, and self-esteem. It's not about implants or dentures winning. It's about choosing what protects your future.
Alright, let's ground this with something concrete. Dr. Esma, give us a quick snapshot. One real case that changed how you explain this to patients.
Sure, Rasim. A woman in her early 50s came in with loose dentures she'd worn for years. Statistically, after about 5 years, many full denture wearers lose significant jawbone volume. She thought the discomfort was normal aging. It wasn't. Her bone had shrunk so much that even new dentures struggled to fit.
So what changed for her?
Education. Once she understood what was happening under the surface, she finally felt in control of the decision.
Now let's zoom into the science for a second. Dr. Esma, what's actually happening inside the mouth that people never see?
Great question, Rasim. Teeth are not just for chewing. Their roots stimulate the jawbone every time you bite. When a tooth is lost and nothing replaces that root, the bone starts dissolving. Dentures sit on top of the gums, so they don't send that signal. Implants do. They fuse with the bone and keep it active.
So this isn't about comfort only. It's biology.
Exactly. When patients understand that science, the decision becomes clearer and far less emotional.
Alright, Dr. Esma, let's shift from fear to clarity. If someone is watching right now and feeling overwhelmed, what's the right way to approach this decision, step by step?
First, Rasim, get a full evaluation, not just a quick look. We check bone, bite, habits, and health. Second, understand your daily life. Do you eat everything? Speak a lot? Travel? Third, plan for the long term, not the fastest fix. That's where many people go wrong.
So it's less about the product, more about the process.
Exactly. When patients follow these steps, anxiety drops and confidence rises, no matter which option they choose.
Before we wrap this up, Dr. Esma, let's talk warnings. If people remember nothing else, what should they absolutely do and never do?
First, Rasim, never decide based only on speed or promises that sound too perfect. Quick fixes often create long problems. Second, don't ignore maintenance. Dentures and implants both need care, just in different ways. Third, never skip follow-ups. That's where small issues are caught before they grow.
And the biggest tool.
Ask questions until you feel calm and informed. Confidence comes from clarity, not pressure.